Diarrhea. Learning points. We will learn following learning points. Definition: causes of diarrhea, pathophysiology. Mechanism of diarrhea, symptoms, management, treatment. Definition: an increased frequency and decreased consistency of fecal discharge as compared with an individual's normal bowel pattern. Causes of diarrhea. Most cases of acute diarrhea are caused by infections. Viruses, bacteria, protozoa. Generally it is self-limiting. Pathophysiology: it is an imbalance in absorption and secretion of water and electrolytes. 4 general pathophysiological mechanisms are following. 1 change in active ion transport by either decreased sodium absorption or increased chloride secretion. 2 change in intestinal motility. 3 increase in luminal osmolarity. 3 increase in tissue hydrostatic pressure. These mechanisms have been related to 4 broad clinical diarrheal groups: secretory, osmotic, exudative, intestinal transit. Secretory diarrhea: when a stimulating substance, e.g., vasoactive intestinal peptide, laxatives, or bacterial toxin, increases secretion or decreases absorption of large amounts of water and electrolytes. Osmotic diarrhea: poorly absorbed substances retain intestinal fluids. Exudative diarrhea: inflammatory diseases of the GI tract can cause exudative diarrhea by discharge of mucus, proteins, or blood into the gut. Intestinal motility can be altered by reduced contact time in the small intestine, premature emptying of the colon, and by bacterial overgrowth. General types are following. Clinical presentation. Acute diarrheal episodes subside within 72 hours of onset. Chronic diarrhea involves frequent attacks over extended time periods. Signs and symptoms includes #sudden onset of nausea, vomiting, abdominal pain, headache, fever, chills, and malaise. Bowel movements are frequent. Intermittent periumbilical or lower right quadrant pain with cramps and audible bowel sounds is characteristic of small intestinal disease. If pain is present in large intestinal diarrhea, it is a gripping, aching sensation with tenesmus, straining, ineffective and painful stooling. Chronic diarrhea: weight loss, anorexia, and chronic weakness are important findings. Treatment of diarrhea involves management of the diet as a first priority. Most clinicians recommend stopping solid foods for 24 hours and avoiding dairy products. Feeding should continue in children with acute bacterial diarrhea. Maintenance of diarrhea. Diarrhea is often maintained by following methods. Through rehydration and maintenance of water and electrolytes are the primary treatment measures until the diarrheal episode ends. If vomiting and dehydration are not severe, enteral feeding (ORS) is the less costly and preferred method. Pharmacological treatment involves, numerous drugs are used to treat diarrhea. These drugs are grouped into several categories, which are antimotility, adsorbents e.g. such as kaolin, pectin, antisecretory compounds. Antibiotics, enzymes, intestinal microflora. Usually, these drugs are not curative but palliative.